Time for the Pat and Aaron Injury Report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. We welcome back to the show on the hotline Dr. Adam Morse. And Dr. Morse, we've got a lot to get to today because we've got some injuries here in Tampa Bay. We'll get to Jamel Dean's injury, but I do want to start with the biggest news around in the NFL when it comes to injuries. Aidan Hutchinson with that bad leg injury. He did undergo successful surgery to repair a fractured tibia and a fibula. He is expected to make a full recovery. Just tell us a little bit about this specific injury, Dr. Morse.
So this is a shaft injury, a little bit different than your ankle fracture, which tends to heal pretty well. He had the same type of injury that you might have remember seeing with Joe Theismann. That was a career ender for him. So hopefully this is something he'll be able to get back from. You saw the similar injury with Anderson Spider Silva in MMA, if you're familiar with that match. And It was basically a shin-to-shin blow. He actually spun around Dak Prescott during that sack, and his leg swung around and hit his defensive tackle's leg shin to shin, and that's what caused that snap. But with any luck, if the surgery went well and he rehabs well and does all his strengthening, there's a reasonable chance that he could get back to playing after.
The Theismann injury was so long ago. I assume that much like we've seen with a lot of injuries and technology and the enhancements of it, that it's gotten more successful as far as giving him a chance to come back and play. Would that be correct?
To some extent, I think there's new technology, new plating and stuff like that, and we have a little bit better implementation of the rehab, and he's not quite as old as Joe was when his injury happened, so he should have a better chance of coming back based on all of those things. But it's still a pretty significant injury that takes its toll.
Yeah, and there were reports there was a rod put in his leg to obviously aid with healing and strength. Can you explain to listeners, whether it be this injury or another injury, people have had different rods, plates put in for different injuries. Explain, is that just about holding the bone together? Is it about the strength? Is it about the recovery? Explain why in situations people or doctors place rods in injuries, and what would happen if that rod were not there?
So if the rod was not there, you'd have to hold it in the cast, and with the thickness of the calf muscle and everything around there would be a lot more movement at the site of the break, and it would allow it to heal in a non-perfectly straight position, which would increase the risk of re-injury. So if you make a big incision across the front of the shin, you can put a really long, sturdy plate on, which would work really well, but there's an increased risk of infection, and you have a huge plate with a huge incision down your leg. So over years, they've kind of switched over to doing what's called an intramedullary rod, or the bone is kind of hollow on the inside, has a soft, spongy bone called cancellous bone. And that bone on the inside of the rod you can put a rod right down the middle, and it'll stabilize
inside
the leg through a much smaller incision. It goes right down the middle of the bone.
Whoa.
Yeah, that's where the rod goes. Yeah.
I want to get into Tua Tagovailoa here because we know about the concussions that he's had in the history there. But we did hear for the first time really since his head injury, the latest one, that his coach, Mike McDaniel, said that he's expected to return this season. We heard that a couple days ago. Is this the right move? Where are we at right now with these concussions, especially with Tua, who we've just seen some really bad ones?
Yeah, and that's the tricky part with concussions is everybody's got a different motivation. The doctor just wants you to stay safe. The team wants, they've got financial incentives. The player has financial and safety incentives that he's in the middle of, where he doesn't want to go back and injure himself, but he's making so much money playing this sport that to give it all up because he had a third concussion is, really difficult to convince him to do. And then you have severity of concussions and recovery from concussions, which are very separate issues. So you can have a really serious concussion and you can completely recover from it 100%, in which case we're a little bit less concerned in the short term about your next concussion. See, I had a patient that was a women's soccer goalie, and she got a concussion, and she was a straight A student in high school, and she got the concussion, and after that, she was always a B student. She wanted to go back to playing, played again, had another concussion, and from then on out, she was a C student. She didn't want to quit soccer at that point because she was going to go to college on a scholarship. So she said, hey, I'm not going to quit playing against our recommendations. Went to college and had a third concussion, and now she's a D student and had to drop out of college And now she's just working small jobs and playing soccer on the side because there's no point in stopping now because that's the only thing she enjoys doing. So my point is that you can have an incomplete recovery after a concussion, which is much more concerning than if you have a complete recovery. And then the severity of the concussion can be mild, moderate, or severe. And some of them take a week and you're back on the field, and some of them can take 2 months and you're still struggling with memory and with concentration and focus. So there's a whole lot of subtlety inside a concussion as opposed to just, oh, we had a concussion, they're all the same. We don't treat them like they're all identical. It all depends on how your body recovers, how completely recovers, and how long it takes to recover, as whether or not that's a reasonable and safe thing to put him back in the field.
Dr. Morse, there's something I kind of threw out there not long ago, all willy-nilly, but I'm not a doctor, so my opinion really is not that relevant in this situation. But you are, so I'm very curious your thoughts on this. Our own Goedeke returned from a concussion. He is now wearing the Guardian cap. I don't know if he's going to continue to wear it, but he's wearing one right now. I had said after the Tua Tagovailoa situation, potentially, should the league consider, if you've had a concussion, now, at least for the rest of the season or for a short time, you've got to wear the Guardian cap? Should they implement that as something that you have to do for your own safety?
I think that that's a valuable tool that the physicians, the league, and the players can be offered to protect them if they're in that interim period, if they come back kind of early and they don't feel like they're back to 100%, but they're close enough that everybody feels safe letting them participate. That's certainly a reasonable tool that you could add to it. But if you have a real mild concussion and maybe you just got like a little confused in days on a play, but we want to err on the side of caution, so we pull you out, and 2 hours later you're back to 100%, and we say, hey, we're going to keep you out for a week just to be safe, and the following week you're 100%, do we need to go to all these extra measures? No. But there are certain situations where, you could either highly recommend it or require it only in a case-by-case basis. I think that would be reasonable. But again, with a dramatic difference in degrees of concussion and completeness of recovery prior to return, that can have a pretty unnecessary effect on some to require them to wear it. And it can also have a pretty significant limited improvement if somebody is trying to come back too soon and say, well, don't worry, we'll have you in this special helmet that's going to save you. It's not necessarily going to do that for you if your concussion is severe enough.
One more here real quick. Jonathan Allen, he tore his pectoral injury. It made me think, Dr. Morse, not so much about Jonathan Allen, but in general for us normal people who aren't athletes for a living. Do you see pectoral injuries a lot? Like how do those come up?
90% of the ones that I see are typically associated with weightlifting.
Yeah.
And with doing really heavy weightlifting, such as real heavy bench press is probably the most common, or really heavy like flies. And that's usually when you're going to see it. The pectoral muscle is your chest muscle. It attaches to your anterior, the front of your chest wall and by your sternum, and then the other end attaches to your upper arm and helps pull your arm in toward your body and forward. So the pushing motion or pushing down motion, like doing a dip, or if you see a gymnast on the rings and they're doing the iron cross and then they're pulling themselves back up, that's the pec that's giving them all of the front side of that strength. And when it tears, it can tear in the muscle, in which case it typically is not a good candidate for surgery. But when the tendon tears away from the bone, the results without surgery are much poorer than the results with surgery. And then the recovery after that can be 6 months plus, which is why it ends up being a season ender. Yeah.
That's why I say don't max out on the bench press. That's why I like to keep it light, Dr. Morse. Right? When you say that, don't max out. It goes too crazy on the pecs.
Yeah, stay away from max and more high reps and a little bit lower weight.
That's right. I'm learning. The Pat and Aaron Injury Report, presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Do not wait any longer. You're dealing with an injury. You know exactly what to do. Schedule that appointment today at floridaortho.com. Dr. Morse, great to have you on the show again, and hopefully we'll talk to you soon.
Yep, thanks for having me. I appreciate it.
Thanks, Doc.
Great stuff as always.